Retinols are amazing. They're number one anti-aging product after sunscreen, but the downsides are not fun. And the main downside most people do experience, especially when first starting a retinol, is dryness, peeling, and irritation. In this video, I'm going to teach you how to combat the dryness and irritation by doing a retinol sandwich method. I'm Dr. Brown. I'm a board certified dermatologist. So let's talk all about retinol sandwich method and how to stop that irritation. So first of all, is everyone going to experience irritation from retinol, and why, and which retinol is most likely to cause it? So if your skin is oily, tough, not really sensitive, not easily irritated, you can use the strongest retinoid and you will be just fine every night. You probably don't need retinol sandwich method. Now, for most of us who suffer with like rosacea or acne or sensitive skin, we're going to get irritated with a different retinol depending which one we're using. So if you're going over the counter and purchasing something, there's retinol and there's retinol. First of all, you need to know which one you have. If you have sensitive skin, you really want to start in a retinol category. Start with the lower percentage, finish your whole bottle out, and then go up on the percent. If that's not irritated you, you can go up to retinol or even get a prescription for retinoic acid, aka tretinoin. Now, I typically prescribe tretinoin, and I'm going to focus on that because most patients really, when they use retinol, it's probably not going to irritate you. So I'm going to talk about tretinoin here. Tretinoin works by exfoliating the top layer of the skin, so dryness, peeling, irritation are common, should be expected, and anticipated. The way to start your tretinoin is through retinol sandwich method, doing it maybe 2-3 nights a week. When your face is freshly washed, your pores are open, they're ready to receive that topical that you're going to put on. Whatever you put on right after you wash your face is going to be the most potent at that moment. So you don't want to apply your tretinoin right away. You're really supposed to wait 20 minutes before you apply your tretinoin. Nobody does that. So what I recommend doing is after you wash your face at bedtime, moisturize. Now, you don't need a fancy peptide moisturizer here. Plain CeraVe, Cetaphil, La Roche-Posay moisturizer will get the job done. What you're trying to do is just create that barrier between the tretinoin and freshly washed skin so it creates less irritation. You're really not diluting your tretinoin here, okay? It's still going to work. After you moisturize your face, one of the questions I get often is, how long do I need to wait before I apply my tretinoin? Not very long. I say probably wait about 30 seconds, if even that, and then you apply your tretinoin. Now, this is the key here. How you apply it and how much you apply will determine your results. So if you're like, I have a spot here and a spot here, I'm going to put it on, you're doing nothing. So it is designed to treat the whole face. You take a pea-size amount. If you don't like peas, you don't know what they look like, take the length of your fingertip right there, split it in half, and put enough tretinoin cream or gel on that. That's your pea. You spread it into dots. I typically just do 4 dots, and then you connect the dots. When you're connecting the dots, make sure you don't get too close to your eyes or corners of the nose or maybe even corners of the mouth. The reason for that is when you experience that dryness, peeling, and irritation, the eyelid skin right through here is very delicate and it will get really dry, irritated, burning, and even more wrinkly. So you don't need to be dealing with that. If you put too much tretinoin in the corners of the nose, if you start noticing that that's itchy or burning, back off. So now you've applied your lotion, you've applied your tretinoin, you just apply a second layer of moisturizer on top, and that's your tretinoin or retinol sandwich. And the purpose of that is to minimize that dryness, peeling, irritation that you're going to experience with it and still see the results. I typically recommend starting this 2 to 3 nights a week and then alternating that with the nights where you have your recovery night, where you only moisturize. So you've given your body and your skin opportunity to heal so that barrier is not irritated. And next time you're applying your tretinoin, you're not applying it to already inflamed barrier. Just listen to your skin. If you wash your face and it feels really tight and dry afterwards, it's probably not a tretinoin night. Take a break. Moisturize. Now, let's say you've been doing your retinol sandwich 2 to 3 nights a week and you have 0 irritation. Go up to 4, go up to 5 nights. If you've done it every night and you've done the sandwich and it doesn't irritate you at all, you can skip the moisturizer underneath or skip the moisturizer on top. But whatever you do, don't go straight to tretinoin directly on your face right after washing it, because guess what? After 3 days, 4 days, you're going to be so dry, peely, and irritated, you're going to think that it's not working. It's just creating irritation or you're allergic to it. It takes 3 months to see 60 to 80% improvement from topicals. I mean, in 30 days, you might see some improvement, but it takes time. Using the retinol sandwich method when starting your tretinoin gives you that time and opportunity to see the results without irritation. I'm a dermatologist and I've even made this mistake. So after pregnancy and nursing, I restarted my tretinoin and I had been missing it, so I went straight for it. Pea-size amount, covered my whole face every night because, there was no events. It's going to be just fine. I'll peel, I'll power through it. Do you know what happens? Periorificial dermatitis happens. What's that? That's irritation, burning all the way around here. It just gets really burny, red, almost looks like eczema, but it's not eczema. It's just irritation from too many skincare items, too much tretinoin. And that's when I really learned that I can use tretinoin. I just need to do retinol sandwich method. After 14 years of using tretinoin myself, I still do retinol sandwich because if I skip the moisturizer underneath the tretinoin, odds are I'm going to be peeling the next day, and nobody likes that. If you've had this happen to you, let me know in the comments below. I'd love to hear what your story with tretinoin is, or if you're already using your retinol sandwich method, I would love to know. If you like these tips, let me know. Comment below, like and subscribe to this channel. You can also follow me on Instagram and TikTok at Dr. Alexandra Brown, ALEKS. 3, 2,